Hey, Frog Prince Runner here, and thank you for dropping by. First, a message for YouTube. This video is debunking an article by a lying website DailyExpose where they claim risk of death due to COVID-19 increases by up to 182% for fully vaccinated people under the age of 50 according to public health data. This is not my view, and I will be clarifying how DailyExpose is misrepresenting the data to basically create propaganda and fear-mongering. I do have to read from that article to provide context and will end with asking everyone to get the COVID vaccine to stay safe. With that being said, let's jump into this dumb article. Public Health England have been periodically releasing a report on COVID-19 variants concern in the United Kingdom, and their latest report was released on the 20th of August covering data on cases, hospitalizations, and deaths due to the Delta COVID-19 variant from the 1st of February up to 15th of August 2021. So far it is correct. Link is in description where one can check out the report. From the article, Table 5 of the report shows that within this time frame, there have been 178,240 alleged confirmed cases of Delta COVID-19 variant in the unvaccinated group of under 50s and 40,544 confirmed cases of the Delta variant in the fully vaccinated group of under 50s. The report also shows that in the same time frame, 1,840 unvaccinated people under the age of 50 have presented to emergency care, resulting in overnight inpatient admission, where 246 fully vaccinated people under the age of 50 have presented to emergency care, resulting in overnight patient admission. PHE's report also shows that 72 unvaccinated people under the age of 50 have allegedly died due to COVID-19 since the 1st of February up to 15th of August 2021, whilst 27 fully vaccinated people under the age of 50 have allegedly died due to COVID-19 in the same time frame. Again, nothing to complain about so far regarding the article. But before we get to the incorrect conclusion, let's have a quick look at Table 5, Attendance to Emergency Care and Deaths of Sequenced and Genotyped Delta Cases in England by Vaccination Status, that is from 1st of February 2021 to 15th of August 2021. We are focusing on the columns 14 days post-dose 2 and unvaccinated for the rows less than 50 years age and equal and over 50 years age. From the table, 178,240 unvaccinated people under 50 attended to emergency care, where the number was 4,891 for people over and equal 50 years age. Without understanding other variables that might affect these numbers, one can incorrectly summarize that Delta variant targets younger people than over 50. I mean, those numbers speak for themselves, right? And that is consistent all across the board. Obviously, the first thing to take into account is the distribution. For example, suppose whole UK has only 48,264 people who are and over 50, where there is 1 billion people in UK who are under 50. Just with that supposition, our previous summarization would be completely opposite, as we have 100% of over 50 are infected, while the infection rate of under 50 is less than 1%. Now we understand that we need to look at that variable. In 2020, UK population under 50 was a little more than 35 million, where 50 and over was a little more than 21 million, the ratio was 1 to 1.655. So if that is the only variable, with for over 50 infected value of 48,264, we should be seeing a value of 79,886 for under 50, where in reality that number is 337,834. Even considering statistical anomaly, we understand there are other variables that is at play. The next one would obviously be vaccination status. NHS COVID-19 vaccination statistics from Sunday 22nd of August 2021, more than 9 in 10 individuals aged 50 and over, that is 94.5%, have been vaccinated with both doses. Let us ask a different question. For 50 and over range, if that 5.5% of unvaccinated group attended emergency at a specific rate, and if vaccination didn't work at all, as in no positive or negative benefit, then we should have a comparable figure for the remaining 94.5%. If vaccination is harmful, we would have a larger number for the vaccination group, and so on. With actual numbers, we have 4,891 unvaccinated in 50 and over group required emergency care. That is part of our 5.5% group. So if a portion of that group equals to 4,891, and assuming vaccination has no effect, we should be expecting a total of around 80,036 vaccinated people to require the same care. That number would be higher if vaccination has a negative effect and lower if it has a positive effect. Obviously, you have to give it some error margin. But according to the table, we have a number of 43,373. Note I included the unlinked sequence in vaccination status, though we should really exclude it as it cannot be matched to individuals. This discrepancy of 36,663 is way over any statistical anomaly and error margin. These numbers speak for themselves. People with vaccine are admitted less than the unvaccinated group. Now this primer was needed to continue with the article. They start with, at first glance, these numbers may make you believe that the COVID-19 injections are working. But when we analyze the number of deaths against the number of hospitalizations and cases in each group, they tell a completely different story. Obviously, we already know that their statement is completely wrong. Let's continue. Out of 178,240 alleged confirmed cases of the Delta COVID-19 variant in the unvaccinated group of under 50s, there have been 72 deaths. This equates to 0.04% of all cases in the unvaccinated under 50s, resulting in death. However, out of 40,544 confirmed cases of the Delta variant in the fully vaccinated group of under 50s, there have been 13 deaths. This equates to 0.06% of all cases in the fully vaccinated under 50s, resulting in death. Note, there is a typo in their article. They meant to say 27. From that, they continue with, that means the relative risk of death due to COVID-19, if under the age of 50, fully vaccinated and then infected with COVID-19, increases by 50%, not the 95% reduced risk claimed by the COVID-19 vaccine manufacturers, the government, and the scientists it employs. Well, time to look at a chart that shows us vaccination status based on age group. For 18 and over, we are around 78% of the population that have received both doses, and around 88% that have received single dose. For 40 and over, it is already above 90%. Let's take a conservative and wrong value of 78%, because we're lumping everyone under 50 in the same vaccination status of 18 and over and ignoring the higher uptake for 40 to 50 group. Back to our previous comparison. If a part of the 22% unvaccinated are receiving emergency care, we should have a comparable figure for the remaining 78% if vaccination has no effect, a higher value if vaccination has a negative effect, and a lower value if it has a positive effect. With 178,240 of unvaccinated people in emergency, we should be seeing around 621,941 vaccinated people where vaccine has no effect, where in reality we see only 159,594, which, by the way, is less than the unvaccinated number, though it involves a larger demography. As for death toll, with 72 deaths from unvaccinated group, we should be seeing around 255 deaths from vaccinated group, again if vaccine has no positive or negative effect, where in reality that number is 41. Once again, less than unvaccinated number despite our larger demography. Thus their final conclusion, this means the relative risk of death due to COVID-19, if under the age of 50, fully vaccinated and then hospitalized with COVID-19, increases by 182%. The data clearly shows that the COVID-19 injections are in fact effective, but only at increasing the risk of death. It's utter and total BS. Now there is a problem with us vaccinated lot. Some of us treat it as a magic bullet, and unfortunately it is not. The efficacy of Pfizer is around 95%, and study has shown that the efficacy reduces over time. And yet, when I go to shop, I see very few people wearing masks and maintaining social distance. That kind of cavalier attitude, in my opinion, is one reason why we're still seeing this kind of numbers from the vaccinated group. As conclusion, please take the vaccine to help yourself, your loved one, and the others you live in a society with. It increases our chance of A. Not catching the virus, B. Reduces the risk in case we do catch it, and C. Decreases the possibility of future variants. Please stop reading and believing in BS websites like DailyExpose and the nonsense propaganda they peddle. I have 2 other videos dismantling the lies they parade, so maybe have a look at those as well to understand how math can be manipulated. Looking at their comment section really makes me feel bad for humanity and wonder how people can be that stupid. Well, that's all for this video. If you think it's a worthwhile video, and to ensure YouTube suggests it, please leave a like and even share it around. If you want to be super awesome, please consider subscribing so you can be updated with my new contents. Let me know what you think in the comment section below. As always, your comments are greatly appreciated and helpful for growth of my channel. Thank you so much for watching. Wherever you are, have a safe day. Signing off.
Try.